The CDC is sending a team to the Canary Islands to meet the Americans on board a Dutch cruise ship following the deadly Hantavirus outbreak there. Officials say they'll be quarantined in Nebraska because there are hospitals in Omaha that specialize in this kind of thing. Remember, this also happened at the beginning of COVID. 17 Americans on board. The disease first spreads from rodents to humans, but experts also say we don't have that type of hantavirus here in the U.S. Officials say all of the people being transported to Nebraska are in good health at this point and are asymptomatic.
Health officials say those passengers were infected with the Andes strain of the virus. And joining us right now is Anne Remoyne, professor of epidemiology at UCLA's Fielding School of Public Health. Professor, we appreciate your time here this afternoon.
Nice to be here. Thank you.
All right, for some context here, the Andes strain is endemic to South America, including Argentina, which is where the ship departed. How rare is hantavirus, and how does this particular strain spread?
Well, hantavirus is in general, we have hantaviruses all over the world, and they do occur everywhere. We've seen cases in Yosemite. We've seen cases in high-profile cases in New Mexico, but in South America, in Chile and Argentina, there are certainly a number of cases every year. It's not completely unheard of. And this one particular strain, the Andes strain, is the only hantavirus strain, or the only hantavirus that actually transmits from person to person.
Yeah, and when you hear that this strain spreads from human to human, although the cases are rare, does it have the potential to spread like the common cold or even COVID?
This is a very different virus. This virus, first of all, you need a person to be infected through exposure to rodents, or your initial person to jump from rodents to humans. You need to have exposure to the droppings. And then there is spread. There are a few studies out there, not that many, but a few that have demonstrated that it usually requires pretty close contact. Eating in the same areas, being reasonably close to somebody. It's not like a respiratory virus, as far as we understand it, which can hang in the air for an extended period of time.
Okay, Colleen talked about the quarantine. Walk us through what that quarantine period will look like for those passengers on that cruise ship.
Well, the passengers on the cruise ship are all going to be repatriated to their own countries. Once they're able to get off the ship, they're going to be put on special flights to get there. In the United States, what's going to happen is they're going to go to Nebraska, and they're going to go and quarantine for up to 42 days, about 6 weeks, which is the incubation period, the time from which you can be exposed and when you would start to show symptoms of this virus. And it's really important because that place in Nebraska has all of the medical care required should somebody actually become ill with it. But this is a very containable disease when you know who has been exposed and you're able to get people into quarantine and isolate them if they're sick.
You know, before we let you go here, what would you say to folks who are worried that this will turn into a pandemic or epidemic? What would you say to them?
I don't think that that's what we're looking at here. And it's really important for people to remember that infectious diseases occur all the time. And what's happened here is you've got a very severe infectious disease, or an infectious disease that could be really severe, that ended up in a ship. And ships are, very, very good at being able to amplify disease. We're seeing a norovirus outbreak on another ship right now, right? So it just got into a very, very unfortunate situation that makes it very easy for that virus to spread. The long incubation period is going to work in our favor because, in general, people take a long time before they get sick. We'll be able to identify most people now that we know what it is and be able to get them quarantined and isolated.
Professor Remoyne, thank you for your time here this afternoon, and thank you for calming us all.
My pleasure. Thanks for having me.
Have a good weekend.
All right, next here at